What we do know with recent data that we've been able to analyse, remembering it's only been just over a week that people have been turning up for these day 5 tests since we opened up on the 13th of December at the 80% double dose mark, that the Chief Health Officer has advised us that the data that we have received just in the last 24 hours can show that we are only seeing about a 0.6% positive cases coming from those day 5 tests. And that means that the Chief Health Officer advised us that we no longer need to continue these tests. And that means immediately, starting from now, and we will be getting information out on social media, but also to all of our public and private clinics out there, anyone who is waiting in lines now for their day 5 test can leave. They will not be required to get day 5 tests from now. We thank everyone for doing the right thing. We have made sure we've done this in a safe and responsible way, but based on the data we now have of our first week, full week of testing, I welcome the advice of the Chief Health Officer that we can move away from that test. Now, I do want to, and the Deputy Commissioner will talk a little bit more about this, advise people who are travelling from interstate that the border pass itself will still require you to commit to doing a day 5 test. So please say yes to that, because that will be the way that you still get your border pass, but we will make sure the website tells you don't actually have to undertake that test. That's just while we update the system. Now, we could have waited a couple of days while we updated the system behind the scenes, but we don't want to do that. There are people today who can be getting on with enjoying time with friends and family and their holidays and not lining up for day 5 tests. So we're getting out and making this decision as quickly as possible, but it does mean the system will take a couple of days to update. So in relation to our COVID numbers, I can report that we've had 1,158 new cases in the last 24 hours. This puts us at 4,779 active cases in Queensland, 257 Omicron cases. I'm pleased to say still no people in ICU, which is very, very positive. We have 6 cases in hospital who are receiving care for COVID and another 83 in hospital due to other reasons, including other illnesses. We've got 26 LGAs that have shown positive cases in the last 24 hours. These will add to, of course, all of the other LGAs. Many of these are existing LGAs that have already reported positive cases, but there are some new sites. I do want to mention one of the new LGAs we'll be indicating today is Doomadgee. However, the individual themselves have not been in Doomadgee while they've been positive, but that is the local government area that they normally reside. They have actually been in Cairns for the period that they have been infectious. We've done 32,007 tests by Queensland Health in the past 24 hours, and we are now at 90.48% one dose and 86.1% fully vaccinated as at the 26th of December. There's been some lag time with the Commonwealth's Australian Immunisation Register data just because of the public holidays. So we expect in the next few days, once it does that catch up, we'll see more accurate data coming through. But it's great we're over 86% double dose, and we've had now a total of 441,426 border passes issued. That's extraordinary. That is almost 10% of the Queensland population coming to Queensland or wanting to come to Queensland in just 2 weeks. So we welcome all of these Queenslanders, but all these people, of course. Some will be returning Queenslanders and some will be visitors. But we are so pleased that they're doing the right thing, getting tested, making sure they're fully vaccinated and before they come here. And they now will not need to do their day 5 tests. I'll now hand over to Dr Gerard, and then we'll hear from the Deputy Police Commissioner. Thank you.
Thank you very much, Minister. In the last 24 hours, we have 1,158 new cases to report in Queensland. This brings the total to 4,779 active cases at the moment. Yet despite this very large number of cases, we are seeing very few cases that are sick in hospital. only 6 patients in hospital currently receiving active treatment for significant COVID-19, and no patients in intensive care or on a ventilator. This indicates that the vaccines are working. But we do encourage everyone, particularly the elderly, and those with underlying immune disorders, to come forward and get their 3rd dose as soon as they are eligible. At present, that is 5 months after your 2nd dose, and that will reduce to 4 months after your 2nd dose in January. But at the moment, it's 5 months after your 2nd dose. Please come forward and get your booster, particularly if you are at higher risk of infection. But so far, we are not seeing large numbers of patients being admitted to hospital, despite significant transmission throughout the Queensland community. Okay, so the cases are being reported from across the state, from north to south. Many of the same locations reported previously. Some new places that we've seen in the last 24 hours include Port Douglas, Cairns, Townsville and Roma. One thing we have noticed is that we are now texting people with their results as soon as we get a positive result, so that people have the opportunity to isolate as soon as possible, even before they get their first phone call from a doctor or nurse. We have noticed that when people get this report, some of them are going straight to the emergency department, even if they are quite well. And this is causing a little bit of a problem in some of our emergency departments, and it's not necessary. So I would like to remind people that if they do get this text, if they are relatively well, please stay at home. Please only go to the emergency department if you have significant symptoms like breathlessness or chest pain. You will be contacted by a doctor or nurse, and there will be instructions on the text message that you receive. If you are unsure, you can contact your GP or call 134 COVID. So you only need to go to the emergency department or dial 000 if you have significant symptoms like breathlessness. So more information about that is available on our website. We have currently 976 patients receiving care at home. And as I said before, they're just the 6 cases with patients with significant symptoms in hospital. Now, with regard to the day 5 testing, we have been following the results of these tests for the past 2 weeks, since the borders opened on the 13th of December, to see how many people are actually testing positive from them. We have data from now for the last 7 days, or for the 7 days leading up to the 26th of December, on 24,084 tests in a cohort here in southeast Queensland, and only 0.6% of those tests came back positive. And it's likely that some of those tests were false positives as well. So the positivity rate in this second test taken on day 5 has proven to be extremely low, remembering that all of these people will have received a negative test prior to crossing the border. So I have discussed this at length with my colleagues and many experts in the field. On the strength of this, I have given a very strong recommendation to the Premier that I believe that performing the day 5 test is unnecessary, and that these resources are better used elsewhere to test people with symptoms and who, for other reasons, who require testing. But I have given the strong recommendation that this, based on the data that we have received within the last 24 hours, our most recent data that we have received within the last 24 hours has indicated that the positivity rate in that day 5 test is so low that it is not contributing in any way to the safety of Queenslanders, and that resource can be used better elsewhere. I think I'll leave it there. Thank you very much, and hand back to the Deputy Commissioner.
Thanks, Dr. Durrell. I'll just start with an operational update. We saw yesterday 34,027 vehicles come across our road borders, with 177 refused entry. Domestic flights, 10,990 persons were checked, 10 were refused entry and 114 placed into quarantine. We did see an increase yesterday of over 100 additional masks handed out to 123 for the day. So the message is still there for our community. Wearing masks when you need to, right across Queensland, so this just doesn't apply to one part of the state, it applies to the whole state, is one of the primary defences against further spread of COVID. So please carry your mask and wear that. That message remains very strong and we'll continue to hear it. We only issued one penalty infringement notice for a border breach yesterday on the Gold Coast, and we checked 120 businesses who were all compliant. We also responded to 57 specific calls for service in relation to COVID-related matters with no action being taken. I'll also address the changes with the border pass on the back of the decision around the day 5 testing. Ordinarily what we would do is wait for the update of that system, and that would mean an IT change, which is what we're going to do, of course. And the work that goes through that in updating the system, then testing it and make sure it works, takes some time. So that will take several days of work. Under the circumstances, on the advice of Dr Gerard and after discussion with the Minister and the Premier, we assured that we could operationalise this straight away, and it's important to do so. So, as we have throughout all of the pandemic response, our police officers will be briefed around the discretion they can apply in this instance. So what that simply means is that until the system can catch up, as the Minister advised, people can apply to get their pass, even though the question may ask them to agree to have a 5-day test. If they just accept that obligation, we will have in play a workaround as they arrive into Queensland so they can come through. Of course, it doesn't really come into effect until after for day 5 anyway, and as we've heard, that's been done away with. So that's a decision that has made a very practical and pragmatic one to get things moving so we can get people back in. And certainly there'll be messaging that will go out through Q Health on their website, and people need to engage with that so they understand it better. So that will be able to be put in place immediately. I just want to finally finish off on a totally different topic, which is just to our friends in North Queensland, that there is a severe weather event expected over the coming days that will come out of the Gulf with a low chance of it becoming a cyclone in that area, but will push across into North Queensland from about Cooktown down to as far as Townsville, where we will see significant amounts of rain and high wind. So the message is very clear for our community up there: be ready for this, and if it's flooded, forget it. We've already lost people this year because of people driving into flooded waters, so it's very important people understand that weather's coming towards us. Thank you. Sorry? So the 72-hour test is something for in the coming days, if the government will consider that. What we're looking at today is the 5-day test. So our discretion now is for the 5-day test. With everyone that arrives, right throughout the pandemic, our officers deal with individual case-by-case assessment of what's occurred. And that's happened right throughout the pandemic. In some instances, they've considered it appropriate to allow people to come in who haven't had their result, but those people still have to go into hotel quarantine at their own cost until they can get that resolved. It's very, very difficult to say this is what we're going to do, cookie-cutter approach for each particular issue, because individual circumstances can vary so much. So our officers are given that discretion to deal with that. They have done all through the pandemic. They continue to do so, and they are around that testing.
What's your advice to people waiting for that 72-hour period? Because we know a lot of people are getting tested and waiting to fly before that and not getting them in time. What's your advice?
Look, my advice is that for those people is they need to understand that under the current requirements, they are required to have a negative test before they come in, before they enter the state. Now, what's happening in some instances is people are believing they're going to get their 72-hour test before they enter, which can mean on the plane, because we're very connected these days, and somehow they're coming in and getting themselves in trouble because they haven't got that test back. That's when our officers will look at these things on a case-by-case basis and make a decision.
We've observed pretty poor compliance in parts of the Gold Coast in terms of using QR codes. Staff aren't checking vaccination status. They're wearing a mask underneath their nose. Has police handed out any fines?
We have handed out some mask fines in the last week, Lydia. I can't say specifically whether it was in that area. I don't have that information. But that's one of the concerns we do have. We're seeing very good compliance in some areas, but in other areas it's just not happening the way it should. So it's a reminder to every Queenslander out there, these directions and the things that we're trying to prevent happening are happening right across the state. We've got cases popping up everywhere. It impacts on everybody. They all have obligations to do the right thing. If we are seeing really blatant non-compliance issues, we will do targeted operations and take enforcement action as appropriate.
Do you think police need to maybe ramp it up a bit on the Gold Coast?
We've run in particular targeted operations on the Gold Coast previously, and certainly we'll do it again if we need to.
If people have that negative test result, but they had their test outside of the 72-hour window because they had to wait so long, will that still be valid?
Look, it's very specific at the moment. It applies for 72 hours. So this is where you get a conflict between what's happening and what the legal requirements are. And as I said, it depends so much on the individual cases that our officers have to make a decision on each case on its merits.
Will people be told to go and get another test and potentially have that same problem?
Look, the obligation is on the... I've travelled recently. I've come back from Melbourne. I know how it works. So people have the obligation to make sure that they can do everything they should, or they do everything that they should to make sure they can enter lawfully into this state. Thank you.
Minister, is it fair? It seems like our testing burden has been eased, but New South Wales, that 72-hour requirement, we're still pushing there, we're testing times out.
Yes, but we've got to understand the difference between a day 5 test that applies to people who have already had a previous test prior to arriving in Queensland versus not doing a test at all. So it's really important to understand there are people, we have over 440,000 people with border passes to come into Queensland just in 2 weeks. There will be many people who have got that PCR test interstate and found out they're positive who haven't come here because of that, and I'm aware of some examples. So it is really important that pre-arrival test occurs. However, as the Premier has said on at least 2 occasions now, if not 3, that we are currently looking at whether we can move to the rapid antigen tests from the 1st of January. But we've also got to make sure there's adequate supply, because to say you don't need to line up for a PCR test in New South Wales or Victoria, for example, and then people find they can't get access to a RAT test, that's not going to fix the problem. So we need to make sure that there's supply, and we're working through all those at the moment. I know there's different types of RAT tests as well. Some are simply saliva tests, some are still nasal swabs, and so some are more accurate than others. So we're just taking advice and we're working through that in a safe way, but we know the pre-arrival test is a really important test. As opposed to the day 5 test, we've got enough data now to show that we can move away from that. I think New South Wales has reported over 6,000 positive cases today. So we know that COVID is spreading very quickly through New South Wales. We've still got to be careful.
What do you say to those who are vaccinated test? Who will pay for it?
Well, at the moment, it's the private individual. So this is something that the Commonwealth should be looking at, whether it should be made available for free or heavily subsidised, because as we move more to RAT tests, and I know that businesses are asking for this as well, and some businesses will just require this of their staff, separate to any public health directive, just to reduce the risk of bringing COVID into the workplace. So, other countries have made this available for free. I think this is something the Commonwealth should be looking at. And I just want to mention, Lydia, you talked about masks. I do want to reiterate to everybody that you should be wearing your mask. So there's requirements to wear a mask. It's mandatory in certain settings like retail stores for staff and for customers, but also in hospitality, staff must be wearing those masks, and customers, we strongly recommend anywhere you're going indoors to be wearing those masks as you enter and exit where you can't socially distance. And yes, I'm hearing of non-compliance in areas around the state, including the Gold Coast. It's really important that people are wearing those masks. It's such a simple thing to do, and it can make all the difference to slow the spread of the virus.
What do you think of the emerging COVID emergency involving a leading private mental health facility in Brisbane in the suburbs? And if so, why haven't we heard about it?
I haven't been briefed on that.
On the rapid test, with the issues with the rapid tests and availability, I understand that they're pretty hard to get at the moment. They can cost up to $50. What are you going to do about those supply issues?
Well, we're checking out what the supply is. It'd be very easy for us to just say, well, people can get a RAT test interstate before they arrive. But we want to know, is the Commonwealth making sure there's adequate supply across the country? Because I can say, my personal experience, every pharmacy I've walked into, every shop I've walked into, they're generally sold out and they've got signs up saying they're waiting for the next delivery. So, you know, there's no point shifting from one type of test to another type of test if you're not confident that that test is going to be available, because as we know, there's still that 72-hour window that you have to have the test. If they can't find a rat test anywhere, then they're still lining up at a pathologist or a public testing clinic and trying to get that test within 72 hours. So we're just working through all of those issues.
Have you considered balancing out the time from 72 hours to like 96?
Look, we will take advice on that, and I know all of the health officials, you know, talk about these issues around the country, but we've got to remember that you know, if we're testing too far out, if they've only been exposed in the last few days and only become, you know, infectious in the last few days, that we can miss that window. Now, we know the 72 hours is used internationally, so anyone arriving into Australia through our international borders have to have that test within 72 hours. We know people leaving the country are having to do 72 hours to arrive in other countries. So this is a general rule, but it will continue to take advice. If the health advice is that we can shift that, then we'll certainly take that on board.
What do you think of Brad Hazzard's comments that Queensland is clogging up their testing and that the Premier's being recalcitrant?
Oh, well, look, I certainly don't support that comment that the Premier's been recalcitrant. I think, you know, we have said, first and foremost, we're about keeping Queensland safe. And we are doing this in a safe and responsible way. We have had our plan out there for many weeks now for everyone to know what is required to come into Queensland. And we've also said that those rules will change when we hit 90% double dose. And we are less than 4% away from hitting 90% double dose, where there won't be a PCR test required at all. So, you know, keep coming out, keep getting vaccinated. If you hit that double dose vaccination, if we hit that 90% quicker, then, you know, we're moving away from those requirements anyway. But we've got to keep Queenslanders safe, and we've got to slow down the spread. We've already got over 4,000 active cases in Queensland in 2 weeks since we opened the border. We have a responsibility to Queenslanders to make sure our health system doesn't get overwhelmed. We understand the pressures interstate, and anything that New South Wales and Victoria can also do to speak to the Commonwealth and make sure that these rat tests are available across the country, then we should all be working collaboratively together to achieve that.
A company in Brisbane has been manufacturing these rapid antigen tests and shipping them to the US for almost a year. Is there anything the state government or the Commonwealth can do to speed up the approval of the TGA?
So at the end of the day, this is TGA's responsibility. I'm sure the Commonwealth's talking to the TGA about approvals and timing of assessing those rat tests. Of course, we want to see local manufacturing. We want to see Queensland produced and Australia produced products, and we should be in this space. And we absolutely want to see Queensland businesses be able to produce these and provide them within Queensland. But it has to be approved. It has to meet our standards, and that is up to the TGA to assess whether it does that or not.
So the Australian News revealed a short time ago Ramsay Mental Health Clinic is in lockdown, with 41 patients prevented from leaving the building, another one's prevented from visiting, 2 staff members positive patients in isolation, and group therapy suspended. What action are you planning to take to find out why this is being kept under wraps until people are aware of it?
Oh, I don't think it's accurate to say it's been kept under wraps at all. We are getting new cases by the hour. It is becoming difficult. We are one of the few states that are recording COVID cases basically right up to the hour that we stand up in the mornings. You know, New South Wales is always cut off at 8 p.m. the night before. We have always collected our data right up to that morning before we stand up. But what that means is they are changing by the minute, and this is probably an evolving situation, and the public health unit on the ground will be the ones who respond and put those measures in place, not the health minister. They are, I'm sure, acting appropriately, just as if we had a positive case in a hospital or an aged care facility, mental health facility. There are vulnerable people there. If they have made a decision that they need to restrict visitors or shut down the facility to reduce the risk of the spread of COVID, then that is their call and that is their prerogative to do that to keep people safe.
Last one.
I don't have any information about the situation.
In the private hospital? No, I have no information about the private hospital, no.
Dr. Gerard, on the day 5 testing, do you
Yes.
have like any data about people who come into interstate and then test positive after day 5? Beyond that, like day...
No, we have no data. No, we have no data on that available at present, no.
Okay.
And the thing about look, I think the thing about this testing, and everyone needs to appreciate this, and our policies. These policies are going to continually change and move forward. Our policies are going to continually change and move forward. We are endeavouring not to move backwards. So we start off with a very cautious approach, and that is what we've had with these pre-arrival testing and the day 5 testing. We've had a chance to analyse the data from this day 5 testing, and now my advice to the government has been that this is no longer necessary, and this will be the case with many other things that you will be seeing in the coming weeks. We were gradually winding back, slowly and cautiously, on many of the measures that we are taking. There may be some bumps in the road with Omicron. Maybe our numbers will increase. We will get substantial numbers in the coming weeks, we expect. But so far, the vaccines seem to be protecting people from severe disease.
This is the last one.
How serious is it that people on the Gold Coast, which is tourist hotspot, aren't using the QR checking codes, not wearing masks?
Oh, very concerned. Because the idea of the mask is to slow the virus down. It's not going to stop it. Wearing masks will slow the spread of the virus down, to take the pressure off our hospitals and to allow people to get their 3rd dose of the vaccine in the coming weeks, particularly the vulnerable. That is the rationale behind measures such as the mask. So they are critical. Even though we don't expect this epidemic to stop now, the masks are still critical.
Thanks everyone. Thank you. Bye-bye.